Welcome to the future of healthcare with YoloHealth's HealthATM. HealthATM is a comprehensive health checkup device by which we can conduct nutritional body parameters and blood checkup, which can be used for prevention and early detection of lifestyle disorders such as diabetes, obesity, etc. When patient comes to the HealthATM, register the patient by their mobile number. Fill in their general credentials, such as date of birth, name, and also capture their photo. An OTP will come on the patient's mobile number to verify it. Once the registration process is done, a patient's profile will be created. Select the patient's profile to start the test. This is the patient's dashboard where you can select different health checkups. Let's start with the wellness checkup. There are 7 steps under wellness checkup. Let's start with height measurement. Ask the patient to stand lean against the wall. With the help of the height sensor, measure the height of the patient. You will see height measurement on the screen. Ask the patient to stand on the body impedance analyzer. First, turn on the device by pressing it. Ask patient to remove their socks. Make sure it's connected to the HealthATM. Once it's connected, ask the patient to stand on the device bare feet. All 10 parameters will appear on the screen of the HealthATM. For blood pressure, put the BP cuff on the left arm of the patient above the elbow. Make sure it's not too tight or loose. Then start the test. Once it's done, transfer the data from the BP device. To check pulse rate and oxygen saturation, we have a pulse oximeter. Put the oximeter on the patient's finger and start the test. Pulse rate and oxygen saturation readings will appear on the screen. Coming to blood glucose test. First, select which type of glucose test is to be done, fasting, random, or postprandial. Always wear gloves before conducting the blood tests. Take out the items used for performing the test, i.e. A. Alcohol swab, B. Lancet, C. Prickling pen, D. Tissue, E. Test strip. Load the lancet into the prickling pen. Take an alcohol swab. Ask for the patient's non-dominant hand. Wipe the patient's finger with the alcohol swab. Prick with the help of the pricking pen. Wipe the first drop of blood using tissue or cotton. Take the second drop of blood in a micro cuvette. Open the flap of the device. Place the cuvette into the glucose device. Once it's done, within 30 seconds, the test result will appear on the screen. For hemoglobin test, take out the micro cuvette for the test. Withdraw the blood same as done for glucose test. Once it's done, place the cuvette into the hemoglobin device. Within 30 seconds, results will appear on both the device and the HealthATM screen. For body temperature test, we have an infrared thermometer or contactless thermometer. Place the thermometer near to the ear of the patient and click its button. The result will appear on the screen. Once the wellness test is done, click on Generate Report to generate the report. You can now take the report in print format by selecting the printer. These reports can also be shared with the patient in different formats, like WhatsApp, email, or SMS. Next is skin checkup. For skin checkup, we have a dermoscope device, which is used for identifying skin infections like rashes, pus, and redness on the skin. Connect the dermoscope device via USB. Once it is connected, a light will come on in the device. Place the device on the infected area of the skin. Capture the image from the screen and upload it. Next is ear checkup. For ear checkup, an otoscope device is used. If the patient has any kind of ear infection, through otoscope, we can take a picture of it. Connect the device via USB to HealthATM. Once it is connected, select the respective ear that needs to be examined. Capture the image of the ear by placing the otoscope into the ear, and click on Upload button. Next is urine checkup. Ask patient to collect urine into a urine container. With the help of the pipette, transfer the urine into a test tube. Take urine test strip box and take out 1 test strip from it. Dip the strip into the urine and remove it immediately. Place the strip onto a flat surface for 1 minute by starting the timer from the screen. After 1 minute, a color palette will appear. Compare the color changes on the strip and select it from screen. Then save it to get the report. Coming to the next, which is lipid profile test. To perform the test, take out a test strip and insert it into the device. Prick the patient's finger to collect the blood sample into the dropper. Now open the flap of the device and dispense the collected blood onto the test strip. Then, close the flap of the device. Wait for the 3 minutes to get the reading. After 3 minutes, you will get the readings on the screen. Next is HbA1c test. To perform the test, take out a test strip and insert it into the device. Add buffer A into the well of the device. Prick the patient's finger to collect the blood sample into the sampler. Add blood sample to the test strip. Now add buffer B into the well. After 5 minutes, result will appear on the device. Enter the result on the HealthATM and save it to get the report. In HealthATM, we can conduct numbers of rapid diagnostics tests such as malaria, typhoid, chikungunya, and many more. To perform the rapid diagnostic test, take out the test strip for which tests need to be conducted. Prick the patient's finger and collect the blood sample in a dropper. Put a drop of blood sample in the sample well and add 2 drops of buffer solution in buffer well respectively. Keep the strip on flat surface for 10 to 15 minutes. Now match the color bands appear on the strip with the images on the screen. Save the particular image to get the report. 12 leads ECG can also be conducted in HealthATM. Ask patient to lie down on a bed, bare chest. Apply ECG gel on the electrodes and clamps of the ECG device and put them on their respective places. Now, start the test from the screen of the HealthATM. A 12-lead graph will appear on the screen. Once all the test parameters are done, a live video doctor consultation can also be done. Book an appointment with a doctor. Patient can have a video call with doctor. Doctors can send a prescription digitally, which can then be printed and handed over to the patient. In YoloHealth's HealthATM, preventive care is now smart and fast.